for me, I feel like there's the lack of interest sometimes in diseases that doesn't affect a certain group of people. The support,
Right.
the push, the money, the funding isn't there unless you convince people that your brother or sister will die from this. If not, if it's so far away, sometimes people that investment isn't there. And so coming here and getting an education here, I don't want to kind of like forget about where it started. So for me, if I get research and I get funding, I want to use it towards discovering drugs for these types of diseases that isn't very popular because some people, they're able to afford it. They don't think about it on a day to day, but I do because I know where I come
Mm, wow.
from.
That whole interested in a certain area of disease based on what population it affects. That's very important. Do you feel that, or I'm not even gonna ask you what you feel. I want to ask you from an educated standpoint what you think in terms of why HIV is still around to begin with. you know, how does the money play a role in uh, the level of, well, you touched on it a little bit, but I guess what I'm asking is how does it play a role in the prevalence of a disease more so than the actual care, than actually caring about doing research or eliminating that particular disease? Like where's the where does the desire come from to eliminate it rather than just studying?
Money is the simple answer. Pharmaceutics and drug discovery, a lot of it is a business decision. A lot of the people the big bosses in these big pharma are are business people, and so it becomes a financial decision. Drug discovery takes a lot of years and investment of money, and so when people are making such investment, they want to make sure that the returns, the people who are buying it can afford it and buy it and get the money. It's an economic decision. And sometimes, scientists can be passionate and scientists can have an interest, but sometimes you have to really convince the people who have the money to invest because of the returns. So if we look at it in America, less than 1% of people, the prevalence is still a million people living with it. But compared to the population, it's not high. And if you look, we'll get into it, the people who have it, even in America, the race that suffers from this HIV is high in Black people and
That's right.
Latinx people.
That's right.
And so, where's the interest? Where's the push? The, there's a lot of political and economical decisions that gets into some of these decision making. And unfortunately, some of our scientists can be passionate about the science and work hard, but sometimes the push from the top isn't there. The support from the top isn't there.